Bioterrorism, a form of terrorism that uses strange, different types of weapons, not the typical guns and missiles we're used to. These weapons can be easily accessible, near untrackable, and deadly to a large portion of the population if not handled correctly. In fact, the risks involved has forced the United States to spend hundreds of millions of dollars on just one of these many weapons. So what exactly are these weapons, and how can they cause so much trouble? According to an article titled Medical Aspects of Bioterrorism by Mahdi Balali and others, quote, Bioterrorism is a terrorist action involving the intentional release or dissemination of a biological warfare agent, BWA, which includes some bacteria, viruses, rickettsiae, fungi, or biological toxins. End quote. These WBAs would be used to kill or incapacitate humans. The dangers of bioterrorism are so high because these WBAs are easy to spread, hard to track, and in most cases difficult to cure. The Center for Disease Control and Prevention classifies these agents and diseases in 3 categories. Depending on their risk to the public, they can either be in Category A, B, or C. Category A from the CDC website includes agents and diseases that pose the most risk to the public. These include anthrax, botulism, plague, smallpox, tularemia, and viral hemorrhagic fevers. These diseases are easily transmitted, have a high mortality rate, and require special action in case of an outbreak. Let's focus on plague as an example. Plague is caused by bacteria named Yersinia pestis. It spreads to humans if they come in contact with fluids of infected animals. However, it can also spread through respiratory droplets, which means it could spread through the air, which is important. The human immune system contains cells called phagocytes, which are supposed to eat pathogens that enter the body. However, these bacteria have capsules that are anti-phagocytic, which protects them. This disease comes in many forms. A few are bubonic plague, primary pneumonic plague, and primary septicemia. The type you get depends on how the pathogen entered the body and where it is present. Although it is questionable if they would work on WBAs, the drugs to cure plague are gentamicin or streptomycin. The main reasons that plague is in Category A is that it's easy transferable through the air and it has a high rate of causing severe clinical diseases. This would make it an ideal weapon for terrorists so that it spreads quickly and causes panic. The next major concern is Category B. These agents and diseases are of moderate risk. They are moderately easy to disseminate, have high morbidity rates, however low mortality rates. They are required to be kept under advanced disease surveillance. Unlike Category 1, this category also includes the water safety threats and the food safety threats. Lastly, Category C is related to pathogens of the future, which are likely to be engineered for mass dissemination. These pathogens would be easy to produce, have high mortality rates, and high morbidity rates, and also cause a major health impact. Agents currently included are Nipah virus and hantavirus. While these are in the lowest category, they are still extremely dangerous, and will probably become more dangerous in the near future as engineering on pathogens advances. Biological weapons have always been used, but the interest in protecting against terrorist attacks is fairly recent. Interest in biological weapons increased dramatically after the September 11th attacks. The world began to realize how dangerous these weapons can be in the wrong hands. This graph shows the increase in the number of articles published on biological weapons after the September 11th attacks. After such an event, people wanted to ensure that all possibilities for terrorism are controlled and precautions are taken. What if a bioterrorism attack were to actually occur? How would it be detected and how would it be handled? An article by Thomas V. Inglesby and Tara O'Toole discusses the effect bioterrorism has on hospitals and medicine. A bioterrorism attack is unique in the sense that those affected would show illnesses days or weeks after the actual attack had occurred, and these people would be spread out across over a large radius. As the doctors realize that there is a pattern of illnesses, they will alert the authorities and act fast to contain and cure the disease. The hospitals and physicians must be ready to provide the increased amount of care needed for possibly a long period of time. What cities or areas are terrorists likely to target when using these biological weapons? Well, the main goal for the terrorist is for the disease to spread uncontrollably as far and as fast as possible. They will likely choose a target such as an airport, and most likely the busiest airport, to ensure the disease spreads all over the nation. Shown here are statistics from Airport Council International, which shows the traffic reports for the most busiest airports in North America. Hartsfield-Jackson Atlanta Airport is first on the list, and New York is sixth. Terrorists would most likely attack airports of the cities on this list. With these heavy threats looming over us, how has the United States government responded? An article in the New York Times titled "Wary of Attack with Smallpox, U.S. Buys Up Costly Drug" discusses the action the U.S. government has taken against smallpox. The U.S. government spent $463 million on a drug against smallpox. It now has enough vaccine for the whole country. However, it has been debated if the U.S. really needed to stockpile such large amounts of the drug and buy them at such high prices, especially since the drugs have no other use. Each biological warfare agent is different and requires a specific drug. Following this model, the U.S. would have to stockpile drugs for the whole population for each agent, and still there is a possibility that these drugs don't work. Is there a better solution? What steps can we take to ensure a safe future? Is the U.S.'s current policy the only choice we have? These questions have to be answered soon because the terrorists will not be waiting.